So what we're gonna chat about today is massaging your Yahoo. So really what we're going to be chatting about is tips on how to prevent vaginal tearing, AKA the tearing of your perineum. So I'm going to use this shell today as a demonstration of what your perineum is and why it is so important to be aware of it if you're giving birth. So a lot of folks do tear their perineum during birth. Basically, your perineum is the area right below your vagina. So this, I know it's very large for vagina, but imagine it's the vagina. And then your perineum would be right here, the skin between your vagina and anus, and then your anus would be below. So some folks, when they give birth, their baby's head is just too big, and as a result, they tear their perineum, which is right below the vagina. They have to get stitches. A lot of folks are afraid of that, and it can be painful, obviously, so you do want to take preventative measures. Finally, what we're going to talk about is the perineal massage. So I'm going to show you how to do this massage. It does involve touching your vagina, so some folks enjoy having a partner do this part. Some folks don't mind if a provider does it, but either way, it just allows for a bit of stretching to happen so that when the baby's head comes out of your vagina, you can help prevent that tearing. That stretching has already happened. Okay, so imagine that this is the vagina, this is the anus down here. So you wanna have someone's thumb just go inside slightly and just sort of go back and forth, like so, in sort of a C-oriented position. Now, secondly, you want to have someone put their thumb in similarly, and then go down to the sides at a 45-degree angle, and then down to the sides at a 90-degree angle. So you can see here those movements. And then finally, another move is to just push out gently when the thumb is inside to help stretch out that area. So basically you're just stretching out the entire area. Starting at around 34 weeks of pregnancy, you, your provider or partner can do this about 3 to 4 times a week. At first, it could potentially be uncomfortable. If it's too uncomfortable, then obviously you want to follow what your body is telling you. Definitely speak with a provider about doing this. But if you have a bit of uncomfortability, this will hopefully get better over time. That's often the experience. You'll basically repeat these movements for a total of 4 to 5 minutes each time you do it. A lot of folks like to do this massage after a bath or shower so that there's already that warmth there. You want to try and use a water-soluble lubricant if you happen to be engaging in intercourse or anything like that. Then you can definitely not use a lubricant if that's comfortable for you. Other organic, unscented, and safe options include natural oils and personal lubricants like KY jelly. However, definitely consult with a provider before using some sort of substance, because you want to make sure that your baby and you are making the right decision for your body. So definitely want to make a provider informed decision. This is not medical advice, so be sure to chat with your provider about this. Well, Angie Angels, that is all of my tips. I really hope that you enjoyed this vlog. Definitely like and subscribe if you did, comment any questions, and if you do happen to be expecting anytime soon, then I would highly recommend that you head to angiehealth.com to consider us as an option at birth. We also offer a community for parents, both prenatal and postpartum. So we have all types of options. We have free classes, courses, and videos like this. I have a personal TikTok following with around 150,000 followers. We are pretty much everywhere where you can find a social media account. So we have lots of free resources, but ultimately our mission is to make sure that parents are able to be protected and feel informed at birth. So one of the ways that I think parents can best do that is save their own stem cells right at birth. My younger brother had cerebral palsy and needed cord blood stem cells. And so my family always wished that we had his umbilical cord, blood, cord tissue, and placenta stem cells saved so that we could use it to help treat his cerebral palsy. That didn't happen, so now I'm on a mission to make sure other families always are informed of their birth options, including things like how to prevent tearing. So that's a little bit about me, and my name is Catherine. I'm the founder of Angie Health, and I love informing parents and chatting with them, so definitely comment anything, even if it's just a hi. I love to see all of you. Okay, Bye.
Hello, Anja Angels. My name is Catherine. I am the founder of Anja Health, so I wanted to personally thank you for watching this video. If there were any specific moments that you liked, then we ask that you comment the timestamp of that moment in the comment section. And of course, like and subscribe if you like this video. We have a ton more pregnancy and parenting and birth provider resources on this channel, in addition to our other social channels. You can find us on Facebook at Anja Health, on Twitter at Anja Health, on TikTok at Anja Health, and at Catherine Anja. That is my personal TikTok where I talk about Anja Health. You can also text us at 310-620-1663. Yes, it is always a real person. And lastly, we have a free community for those that are interested in pregnancy, birth, or cord blood banking. So you can join us there at anjahealth.com/community. And then lastly, we have a podcast, the Better Birth Podcast by Anja Health. So we would definitely love to meet and see you on any of those channels, whichever one is your favorite. Once again, thanks for watching and hope to see you at our next video.